Jason, we don't have to look very far to see the anger in Europe over the reaction there to the spread of COVID. Do you think there's a risk that we could be next?
There is a risk, but we've been assured over the weekend by Professor Sir Andrew Pollard, who's director of the Oxford Vaccine Group, that we are perhaps unlikely to see the same spike in this country that other countries, like you mentioned, Belgium and the Netherlands and others across Europe have seen, because earlier on in the pandemic, the UK's COVID cases were higher than a lot of those countries, and we have a stronger immunity as a population to the Delta variant, which in particular is causing these spikes and leading these governments to implement all these new restrictions. So the situation is optimistic at the moment, going by the scientific advice. At the same time, there is always a risk. At the press conference last week, Boris Johnson was talking about a blizzard of COVID, talking about it almost like a weather front coming across Europe towards us, and Sajid Javid making clear that more restrictions are not off the table if they're necessary in the coming weeks.
When you mention those restrictions, what would those be?
Well, the restrictions that we've seen across Europe, which if there's a similar spike in this country, it's likely to be implemented here as well. You mentioned there was a 3-week partial lockdown in the Netherlands, tighter restrictions on face masks. We've already seen controversy over the decision to mandate vaccines for those working as health workers and carers. So similar restrictions along those lines. Possibly, I think it's likely we would see restrictions on big crowds at sporting events and concerts and things like that. So those kind of gentle introductory lockdown measures that we saw earlier this year and last year to try and see off any spike.
Now, looking at what's happening here in the UK, Sajid Javid was on the telly yesterday. There are a record 6 million people on the NHS waiting list for treatment. That's going to be a story that just gets bigger and bigger, isn't it?
Exactly right. And even Sajid himself says that the waiting list will only get worse before it gets better. The NHS is under unprecedented demand. Of course, we're heading into winter when demand is always going to be tough for the NHS anyway, combined with the potential for an increase in COVID cases, combined with the huge backlog, which currently stands at about 6 million cases. Chris Hopson, the chief executive of NHS providers, is very concerned about this. He says that even when case numbers are low, even when it's only a small proportion of hospital beds that are taken up with people who are suffering with COVID, it still has a significant effect in winter because some other beds are out of action, because you have to protect against COVID infection, so you can't use beds in the normal way. And so it can be a significant proportion of the beds in hospitals that are unavailable at a time in winter when the NHS is often very, very close to capacity anyway. And so even if COVID cases do remain relatively low, we might still see a situation where the NHS gets very close to being overwhelmed over the next few weeks and months.